Shawn and Sue, it's a Feel Good Friday. It's our final Feel Good Friday. No, Sue, you don't want to hear this.
I don't. You know how much I love summer.
The final Feel Good Friday of the summer, unofficially, of 2025. And we go out on a high note. Joining us right now is Patrick Ahearn, the CEO of Community Medical Center, to talk with us all about a lot of things that are going on and things that are still to come with our friends at RWJBarnabas Health. Pat, good morning, and thanks for being with us.
Good morning, Shawn. Good morning, Sue. It's always a pleasure to be with you guys. It's been a great summer, and I want to thank you for having all of our guests on this summer. It's been terrific. Thank you.
You bet. They've been fabulous, Patrick, by the way. They have been so good this summer.
Yeah, we got some really good people that, more importantly, are delivering a message to the community about what we do, and they're really great, so I appreciate it.
So speaking about that, driving past CMC Community Medical Center, I've seen a lot of changes. What's going on there at CMC?
Thanks for asking, Sue. It's been crazy. As we talked about over the last few years, we were committed to I want to say a $600 million building project that we were doing, and we started it a year or so ago. And what you see if you're driving past is the brand new garage, which opened in February. And so, we're excited about that. And it looks beautiful, and people have really made great comments about it. It's been convenient. We don't charge for parking anymore. We have valet, so it's been a lot of fun. But and I appreciate the tolerance of all of the folks that have been coming on campus, because when you're under construction, it's always a challenge.
We get a lot of questions. When is that parking garage opening? It's good you answered that question. So it's February 2026.
No, it's already open. The garage is open.
Oh, the garage is open. All right. I guess it's throwing them off because of the main entrance, and what you're doing there. Tell us a little bit about that.
Yeah, we talk about it at the hospital. I always say to the employees, we're in the non-sexy phase of when you're doing your work at home, right? So if you think about home, you say, I have to do the hot water heater or the air conditioner. Those are I call the non-sexy phase. Everybody wants to do the kitchen and the bathrooms and things like that.
The bathroom, the new shower.
Right.
Put that new flat screen up on the wall, Pat.
Yeah, so we're in the non-sexy phase, and that was the garage. And now it's the central utility plant. So the reason that the front entrance is closed is we're running, and if you look on campus, you see old trenches. We're running all of the utilities from the hospital. We have 6 different buildings, and we're running all the utilities from all those buildings into what we call the central utility plant, which is the next piece of the project that will go up. So we're running the lines across the road. And now we'll build a building starting in a few months, and we'll have all the utilities in one place, which anybody that knows Tom's River, you have a lightning storm or a thunderstorm, you're out of power, right? And so,
the worst.
And that really affects our patients. We can't afford to be out of power. So the new central utility plant will have all sorts of backup and redundancies, so we're excited about that. But that'll take about 6 to 9 months to build.
I want to go west. Let's talk a little bit about the Toms River West Hub. Explain what the West Hub is all about.
Well, as we've talked about in the past, Shawn, I don't want people coming to the campus that don't need to come here. If you're really sick and we need to take care of you, we're here for you. But a lot of times people are getting quick same-day surgeries, or they need a radiology study or some physical therapy. They don't need to come on campus. So the Toms River West Hub, as with some of our other hubs, right, we've done 5 of them over the past several years, is to really bring the services out to the community. And so we're excited because that's finally finished. The last piece of it opened a few months ago, and that's the beautiful new same-day surgery center, 5 ORs, 2 procedure rooms. It's absolutely gorgeous. And again, it's same day, so people come in. It's a great setting. They get their stuff done. They go home. We give them a call afterwards, make sure everybody's okay, and they don't have to come into the hospital. So it's a win-win for everybody.
A little daunting sometimes, right? To go, maybe this will be a little easier for your patients.
Yeah, especially as we just talked about, front entrance closed, construction going on.
Yeah.
You don't need to come here if you don't need to be here.
You've got other locations for the hubs I want to mention real quick. Barnegat, Forked River, Lakewood, and now the 2 in Toms River.
Yeah, and the Barnegat one we expanded this year to include full cardiology services. So that's been a a real success. The people at Barnegat in that area have really embraced us to the point where we continue to expand that one.
As we get set to wrap up today.
Yeah, we've been talking to Patrick Ahearn, CEO of Community Medical Center. What stands out to you about CMC after the first 6 months of 2025, Pat?
Great question, Sue. There's so much going on here. I think one of the things that my commitment to the community has been we should do about 95% of what our patients need here. I don't want them going other places. And if they have to get really high-end stuff, really esoteric things, I want to be able to get them to where they need to be quickly. But from that 95%, we said, okay, what do we need to do to upgrade our services and make sure that we have the professionals to take care of the folks? We've added over 20 high specialty physicians in the first 6 months of this year.
Wow.
And I'm talking about cardiologists, neurosurgeons, breast surgeons, pulmonologists, and that's exciting because we're talking about people that are really well trained, coming from great programs across the country, and they're coming here to Toms River to deliver service for our patients.
That's great to
so
hear.
I'm excited about that, and with that, our patient satisfaction has improved dramatically. Patients are really loving what they see here and the service that they're getting, and so it's we're in a good spot and obviously growing significantly. So we're here to take care of our community. That's what we're here for, and I
Keep
think we're
moving on up,
fulfilling
right?
that.
Keep
Oh,
going.
absolutely, and
Patrick,
getting better and better. So
Yeah, you bet it does.
I want to take a moment to thank all of your staff that joined us over the weeks of this summer to shed light on all their different specialties at Community Medical Center and along with RWJBarnabas Health. And also, I want to thank Rob Kavanaugh and Stephanie Reynolds, your staff that helped to put all this together and sort of coordinate your, folks with us here at the station and with Town Square Media. So thanks to everybody, Pat, as always.
Yeah, Rob and Stephanie do a great job coordinating with you, and we couldn't do this without the two of you, so we appreciate you always supporting us, getting the message out about what we're doing, and you're part of the community, so you're an important voice for us. So thank you for always being so kind and generous.
Thanks, Patrick.
Pat, have a great fall, and we hope that autumn will bring a lot more great weather to get this construction work done.
You're not telling Patrick to fall.
No,
okay.
But if he did,
Listen,
he's
has it
he's
covered.
got an umbrella of facilities. Yeah.
Just in
Thank
case.
Thank you, guys. Have a great fall. I'll talk to you soon.
Have a good one.
Pat, have
Bye-bye.
a good day. There he is, Patrick Ahearn. And, a lot of fun. Our final Feel Good Friday with Shawn and Sue.
Wow, I can't believe it. Summertime flew by.
RWJBarnabas Health and 92.7 WOBM.